Hello everyone, this is Dr. Sultan Minuddin Shaukat. I welcome you all to Ikramed Academy. You have seen me before in multiple lectures and multiple sessions on abdominal ultrasound, ultrasound of pelvis, OBS ultrasound. So we have a series of recorded lectures on all of this. In this series, we are discussing about small parts, imaging techniques, as well as ultrasound findings in thyroid. Now, as I have told you right from my first lecture, पहले सेशन से आपने देखा है कि थायराइड में अल्ट्रासाउंड हैज गॉट अ वेरी वेरी इंपॉर्टेंट रोल। दो चीजें हैं, काफी लोगों को, काफी क्लिनिशियंस को, काफी पेशेंट्स को इसका पता ही नहीं होता है कि थायराइड का भी अल्ट्रासाउंड किया जा सकता है, especially if there is thyroid nodule, thyroid lesion, to characterize the various lesion. I advise you before you start this session, which is based on ultrasound features of thyroid lesions, in which I will cover the findings of benign lesions as well as I will be discussing about the findings of malignancies. I advise you to go through my previous sessions, which are based on thyroids. I have discussed how to grade from thyroids 1 to thyroids 5. I have taken 3 sessions on that, and beautifully, if you go through it, you will understand thyroids, it will become perfect. Okay, now, so एक बात तो पक्की हो गई कि जब भी थायराइड में लीजन्स आए, we have to interpret it on basis of thyroid, on the basis of thyroids. Okay, तो हमें thyroids देना होता है, but इस सेशन में I'll be discussing कि specific tumors like specific cancers like papillary carcinoma of thyroid और medullary carcinoma of thyroid, वो अल्ट्रासाउंड में कैसे दिखते हैं. So जरूरी नहीं कि once you see that you give those findings as papillary carcinoma of thyroid. You on report give that as thyroid's 5 lesion, but you can mention that this is highly suspicious of papillary carcinoma of thyroid and you suggest FNSC or biopsy accordingly. बात समझ में आ गई. At the same time हम बहुत सारे ऐसे findings देखेंगे which are ancillary other than that features which should be seen in those patients. So I will also advise you the clinical importance of diagnosing follicular CA or papillary CA or medullary CA. So we'll be seeing about all those in this session. Okay, chalega. So without any delay, let us begin with the after this brief introduction. Yeah, brief introduction from my side. I'm Dr. Sultan Minuddin Shaukat. I've completed my MBBS MD in radio diagnosis, gold medalist in the subject, and of course a faculty in Ikramed Academy. Before I start, I would like you to go through my previous sessions, and also I request you all to comment and you can mention your feedback in the sessions. Okay. Sure. Now, the first thing I would like to start with is nodular hyperplasia. Okay, let us start with something which is benign and then we'll move to malignancies. Okay, so what do you mean by nodular hyperplasia of thyroid gland? This is enlargement of thyroid gland. Enlargement of thyroid gland is termed as hyperplasia. Now, there can be multiple causes. It can be idiopathic, that is unknown, कोई reason पता नहीं. Iodine deficiency बहुत ही important cause है. So remember, iron deficiency is one of the very important reason for nodular hyperplasia. Why is this important? Iodine deficiency कहाँ पे होती है? Iodine deficiency is more common in hilly regions. Iodine deficiency is more common in hilly regions. Now there is an entire belt in India which is called goiter belt. Okay, very common in areas of hilly regions, the Himalayan belt. Okay, all those people who live near Sayadris, all those people living in hilly places, they have deficiency of iodine. अब एक सवाल ये भी होता है कि आयोडीन पाया कहाँ जाता है. So iodine is found in soil of an area, and जब उस soil में आयोडीन डेफिशिएंसी होती है, क्योंकि हिली रीजन की soil बह जाती है, as a result there is iodine deficiency and these people they suffer from goiter. So here Always when you have a patient from hilly region, always you should look for goiter, you should look for MNG. What is MNG? Multinodular goiter. It's a benign lesion. Okay, that is multi. If there is single nodule, we'll call it as a single nodule. But sometimes you might have, if this is a thyroid, you might see multiple nodules within the thyroid. Entire thyroid would be enlarged, multiple nodules would be seen. This is called MNG, multinodular goiter. Okay. Now, sometimes the goiter may be familial, it runs in families. Okay, we also will see that diseases like thyroiditis, that is autoimmune disease of thyroid, can also be familial. If mother has it, there are high chances that the female child can also have it. Remember, एक ट्रिक है, क्लिनिकल ट्रिक, कि जो ऑटो इम्यून डिजीज होते हैं, ऑटो इम्यून डिजीज, ऑटो इम्यून डिजीज यानी हमारी बॉडी की इम्यूनिटी खुद अपने सेल्स के अगेंस्ट में एक्ट करेंगी, दैट इज कॉल्ड ऑटो इम्यून. Okay, ideally immune system has to protect the body, but here immune system starts destroying the cells. So a very important category of disease in this case is Hashimoto. Okay, Hashimoto's disease. Now एक important बात बताना था कि autoimmune disease is very common in females as compared to male. Very important. And most of the times, most of the thyroid disorders, be it Hashimoto, be it MNG, be it adenoma, be it colloid goiter, are more common in females. ऐसा नहीं है कि males को नहीं होता, but always females are more affected with thyroid disease as compared to males. तो जब भी female आती है, तो you should think this patient could have a thyroid illness. Okay, especially in case of neck swelling. Okay, hypothyroidism is now increasing in India. Okay, now there are certain medications which can also cause thyroid hyperplasia. Now there are certain infections, so we'll see those special type of thyroiditis where, you know, in infections also there can be hyperplasia of thyroid. Hyperplasia progresses to nodule formation, and then the designation of this nodule can be hyperplastic nodule, adenomatous nodule, or colloid nodule. So we'll see all of this, but let us come to very fundamentals. So suppose you have a thyroid gland. Let us see. So this is the right lobe of thyroid, isthmus of thyroid, and left lobe of thyroid. Okay, बात समझ में आ गई? Yeah. So this is your thyroid gland, and suppose you have got iodine deficiency, or the patient has got iodine deficiency. So iodine deficiency से क्या होगा? See, what is the function of thyroid gland? Synthesis of T3 and T4. So now this thyroid will not synthesize T3 and T4. T3, T4 synthesis will go down because there is iodine deficiency. So as a part of negative feedback mechanism, there is a negative feedback mechanism which will stimulate the synthesis of TSH from pituitary. So pituitary TSH बढ़ा देंगी, and जब pituitary TSH बढ़ा देंगी, this will stimulate hyperplasia in thyroid gland. So initially the follicles in thyroid will start getting hyperplastic, but still if there is deficiency or still the causative agent continues, this hyperplasia will become a solid nodule. Solid nodule. Now, ये चीज देखने के लिए कि how does solid nodule look, you need to go in my session on thyroids, in which I have described how solid areas look, how cystic areas look. तो आप उधर जाइए और उस सेशन को अच्छे से रिवाइज कीजिए. Okay, now let us come back to this. So it might form a solid nodule which is called adenomatous nodule. Now what might happen sometimes is that inside the center of this nodule, the nodule can become a cyst if the central area undergoes degeneration. Cyst is filled with fluid. So sometimes you might have thyroid cysts, okay, or solid nodules. Now these are usually to start with they are benign, but certain amount of time you might have malignant lesions, and what are the risk factors for malignancy. So one of the very important risk factor is exposure to radiation. If there is exposure to radiation, you might get a malignant lesion. Do you remember malignant lesion? Do you remember malignancy के हमने क्या features देखे थे Thyroids 5 में? I want you all to revise that. So let us start revising. What are those features of malignant lesion? I'll use a different color for this. So you should have a lesion which is wider than taller. Okay. So this lesion number one, it should be wider than taller. Important. Okay. Sorry, it should be taller than wider. Sorry, I said the reverse. It should be taller than wider. I drew it correctly, but by mistake, I quoted it wrong. So this should be taller than wider. If it is wider than taller, it favors benign lesion. So taller than wider. Now, so this is number one. Number two is presence of microcalcification. So microcalcification is a very important sign of malignancy. Number three, increased vascularity. Solid area with increased vascularity. Number four, usually whatever malignant lesions are there, they are solid. Number five, very, very important criteria for Thyroids 5, which is it should be hypoechoic. जितना ज्यादा hypoechoic, उतना ज्यादा malignancy का chance. Remember, cysts are anechoic, solid hypoechoic mass is goes in the favor of malignancy. Okay, so whenever you have a lesion, you should look for these features. So you should look if it is taller than wider, you should look for microcalcifications, you should look for increased vascularity, you should see for whether it is solid or not, and you should see whether it has got a hypoechoic areas or not. Okay, yeah. So with this, let us come to the various findings in multiple nodular hyperplasias. So now, this is an example of nodular hyperplasia. So we have 6 images. I want you all to see these images after seeing my previous lectures. Okay. अब इसे हम हर एक को एक एक को डिस्क्राइब करेंगे. Okay. We'll be seeing each of this. चलो, we'll start with first image. So let us start with first image. So here you are able to see this. This is the thyroid gland, and within the gland you have this lesion. How is it? It is well defined. Okay, well defined. And echogenicity is nearly isoechoic, and you are able to see multiple which areas. What are these areas called? These are called sponge-like areas. So this lesion is a spongiform lesion. अभी याद आया? I have told you, whenever you have cystic lesion or spongiform lesion, these are benign. This goes for Thyroids 1. Okay, so this is a benign spongiform thyroid nodule. Okay, तो इस सेशन में मैं ये बताऊंगा कि कैसे फाइंड आउट करेंगे कि वो बिनाइन है या malignant है on basis of ultrasound features. Sometimes it might be intermediate, you cannot tell, but एक आइडिया लग जाती है. ओके, चलो, this was number 1. Number 2, let us, so this is a benign lesion, benign nodule. Number 2. So now in thyroid, you are able to see this well-defined lesion, which is a nodule, a well-defined nodule. Okay. Now, और क्या दिख रहा है? See, can you see that this is anechoic? What do you mean by anechoic? It means it is completely dark and you are able to see this posterior acoustic enhancement. I've talked about this in my previous session. What is posterior acoustic enhancement? You compare this region with this, so that means that this is a cyst. And in this cyst, you are able to see multiple septae. And within that, again, you are able to see more cysts. So this is a multicystic nodule. Slight amount of, this can be a solid component or this can be just a debris, okay, or this can be just colloid material. So how do you differentiate whether it's solid material or colloid material? You have to ask the patient to move. Okay, so in this case this was minimal, this was a minimal solid component. Okay, so if you decide to take FNA later on, you should take FNA from this solid area rather than taking it from cystic material. Okay, usually malignancies lie in solid material, not in the cystic material, but this turned out to be benign lesion. Now here you look for image number 3. You see here, this is again a well-defined, wider than taller cystic nodule, but are you able to see that there is a solid mural nodule? So this is a solid mural nodule. This is colloid material. Can you see fine echoes, moving echoes within it? So colloid material might show sometimes fine moving echoes. So this is a cystic colloid nodule, but it is having a solid area. And are you able to see this? So what are this? These are nothing but comet tail artifacts. Comet tail artifacts. Okay, so these are all comet tail artifacts. So when you have this comet tail artifacts, it means that this signifies it is benign. Okay, so now let us come to image number 4. Here you are able to see a well defined cystic anechoic, but the shape is irregular and you are able to see multiple few echogenic scattered uh, scattered areas within it. So this is, but the wall is very thick. Okay, here the wall is very thick. Again, this was a benign nodule with thick wall. Okay, so sometimes the cystic nodule might give this appearance. Now here, let us come to image number 5. Here you are able to see a well-defined oval cystic lesion within thyroid, and there are multiple anechoic cystic area. So this is looking like spongiform nodule. So these are scattered cystic components, and then there are a few solid areas which are isoechoic to the gland. Again, this is seen in case of benign lesions. Okay. Now here you see that there is a solid nodule, but if you compare it, this solid, it is isoechoic. It is isoechoic to that of the thyroid gland, and it is showing heavy vascularity. So whenever you have solid nodules, if it is isoechoic, most likely it is benign. But remember that there are chances of it being follicular CA. So always for solid nodule, get a biopsy done, especially if the category becomes thyroid 4. Okay. So you need to get FNA done for this. Okay, as the vascularity is highly increased, although it is isoechoic, so chances of malignancy would be less. There would be more chances that this would be adenoma, but still you should not take chances in such patients. Okay, so now we'll move ahead. Now there are few atypical nodular hyperplasias. So here let us see those examples. So here you are able to see a solid cystic well-defined nodule. There is central cystic areas. Okay, but if you see, this is isoechoic to that of gland. What do you mean by isoechoic? Same echogenicity as that of the thyroid gland. So here echogenicity of the thyroid gland and that of the cyst is same. There are large central cystic areas. So here which area is more? The solid area is more. correct? This all is solid areas. So solid area is large as compared to cystic areas. Although this is isoechoic, so I have told you which malignancies of thyroid can be isoechoic or hyperechoic. Answer is follicular neoplasms. Okay, follicular neoplasms. So always get an FNA done from the solid area to rule out follicular neoplasms. Okay. Now again look at second image. So here you are able to see a well-defined solid nodule. This is again a solid nodule. And if you compare it with the main thyroid gland, this is hyperechoic. Okay, this is iso to hyperechoic. So you can say this is iso to hyperechoic, and we have a peripheral halo. I will show you what peripheral halo means. Yeah, this one. So are you able to see this hypoechoic area surrounding the nodule? This is called surrounding hypoechoic halo. Okay. So again, this turned out to be benign, but you need to always get FNA when you have such a large follicular, when you have such a large nodule to rule out follicular neoplasms. Okay. Now look at this image here. You are able to see this trachea and this is isthmus, and very important, you are able to see a well-defined. What is most important about this lesion? This is hypoechoic. So whenever you have any lesion which is hypoechoic, always rule out malignancy. So this uh, came out to be benign, but always remember there are always chances that this may turn out to be papillary CA. So always rule out malignancies in such nodules. Okay, we should never take risk when you have a hypoechoic nodule. Remember. Chalo. Now with this, I'll tell you what the important thyroid malignancies are. So there, of course, there are four important malignancies which you should know, and the fifth one I'll be telling you. So you have got follicular CA, number one. Okay. Number two is follicular CA. Number two is papillary CA. Number three is medullary CA. Number four is anaplastic CA. And there is fifth one, which is lymphoma of thyroid gland. Okay, so in this slides, in my subsequent session, you would be seeing on these various malignancies, that is follicular, papillary, medullary, anaplastic, and lymphoma. Thank you.